It is such a problem in our community and in cities and suburbs across the country. I'm talking about the heroin epidemic. Just about every day brings headlines of another overdose or more dangerous highs. And just about every day people ask, how do you fight this? The struggle prompted an editorial you can find right now on WCPO.com. I'm here with WCPO.com's Dave Holthouse. He founded the Heroin Advisory Board, and he is the author of the editorial. And Dave, I have to ask you, you're really taking the Trump administration to task here. Why?
Well, it's been over a month since the president said that the heroin problem is an emergency. But since then, there's been no action, really. No executive orders, no plans. So what's he waiting for? This is a crisis where people are dying every day in increasing numbers. So what's the plan? We need some action, and he has the power to do that. So that's where we're at.
So in the absence of a plan, you guys have put forth ideas. Can you give me your top three?
Sure. Number one, declare this a public health emergency. This is a public health issue. Addiction is a disease. It's a very complicated disease, but it's a public health problem, not a law enforcement problem.
If you declare it an emergency, how do things change?
Well, I think it would give the president the ability to free up money and resources. The federal government has a lot of both at its disposal, and he could do that without legislative action. So it would bring some immediate funding and people to bear on the problem.
Okay. Number two suggestion.
Number two is we need more funding for treatment. We need more treatment. And not just beds, but we need more physicians who are trained in addiction medicine. We need more physicians who are certified to prescribe medication like Suboxone that works for addiction. There's a shortage of those people now. The federal government can create programs that would incentivize people to go into addiction medicine or to get certified in addiction medicine. We need a lot more of that.
And we talk about detox and rehab. Is 30 days enough?
No, definitely not.
Okay.
Most professionals in the field will tell you that that's just the beginning. Recovery can take much, much longer than that, years in fact.
Okay, number three issue.
Well, number three is we do need some tougher penalties for traffickers and dealers, and to get these people off the streets. They bear a lot of responsibility for the death toll. Unfortunately, a lot of them are going in for a short time, getting out on probation, going back to the same old thing, dealing drugs. We need some tougher penalties to keep these folks locked up for a while.
Dave, your article highlights how many different suggestions?
There's 5 or 6 suggestions on what to do, and these have all been vetted by our Heroin Advisory Board, which is a group of professionals who are working in the field every day. And you know, this is something that they've been working on, studied, and kind of agree that this is where we need to take this problem.
All right, thank you for joining us. And if you'd like to read more about the suggestions that the Heroin Advisory Board has in Dave's editorial, all you have to do is go to WCPO.com. Now,